Greetings and welcome to all. So today I'll be discussing a very important part of dental anatomy subject, that is tooth identification. It is always a part of regular classes and also a practical examination. The knowledge of this exercise is very important. It has a very strong clinical application, and this knowledge can be applied in every branch of the dentistry, including forensic odontology. Now the time limit is very less. It ranges from 2 minutes to 5 minutes. It depends on the university guidelines. Now students are always confused what to write about the spotting examination in such a short duration. Now in textbooks the detailed morphology is given, so we can't write the detailed morphology in such a short duration. In textbook it is given aspect wise: labial aspect, buccal aspect, lingual aspect, palatal aspect, occlusal surface, proximal surfaces, and root description. It is not possible to write everything in that short duration. Therefore the description is divided into different categories which are called as traits. Like suppose for this tooth, this is a maxillary first premolar. So we need to justify few points under each category, and finally we need to write the identification is permanent maxillary first premolar. The knowledge of this exercise can be applied to every branch of dentistry, including forensic odontology. Therefore, the description is categorized under various headings which are called as traits. Now, suppose if we identify this as permanent maxillary first premolar, then for every word we need to justify, like why is it permanent? So the features which we write under permanent category, it becomes set traits. Then why is it maxillary? Why not a mandibular premolar? Then it becomes an arch trait. So all those features which we write under this becomes an arch trait. Then why is it first premolar and not the second maxillary premolar? Then it becomes a type trait. Why is it premolar? Why it is not an incisor, canine, or molar? So whatever features we write under this category will be called as class traits of premolar. So the features should differentiate between maxillary and mandibular, which becomes arch trait, and it should differentiate between first and second. So we need to justify why is it the maxillary first premolar, not the second, and also we need to differentiate that why is it premolar, not the incisors, not the canine, and the molar. So we need to differentiate from other classes of teeth, which becomes class trait. Now first very important part is the tooth should be placed properly in an anatomical position. Now suppose this is a maxillary tooth, so then crown down and root up. So we need to write few points for each category to justify the identification. So accordingly our description will be categorized under these headings. So we need to write only important points under these headings just to justify all these points. So first is set traits. So under set traits, like all the permanent teeth are more translucent and they are not milky white in color because they are highly mineralized. So one general statement we can write that it is more translucent. And secondly, these teeth are absent in deciduous dentition, so they are present only in permanent dentition. So this becomes a set traits. So we have justified that it is a permanent tooth. Then second is arch trait. So we need to justify why this tooth is maxillary first premolar, not the mandibular. So maxillary, so first is root is bifurcated. As we all know, the maxillary first premolars are they have bifurcated root. Now I am keeping mandibular premolar in an anatomical position, and then we can see the root is single. So this is how we can differentiate between maxillary and mandibular. And secondly, the crown is upright instead of lingually tilted crown. Now we can see approximately maxillary premolars, the crown is placed upright on the roots, but if you see here, the crown is lingually tilted. The crown is lingually tilted. Occlusal surface is sloping and the crown appears to be lingually tilted, and the root axis is straight and the crown axis is like this. So crown is lingually tilted. That is why it is not a mandibular premolar. Then mesial marginal groove is present, and also the canine fossa. Now this is a mesial marginal groove. You can see on the mesial side the groove, it starts from the mesial pit and it crosses the mesial marginal ridge and it is extending on the mesial surface. So this is called as mesial marginal groove. Sometimes it is also called as mesial marginal developmental groove. And since on the mesial side a bulky canine crown is present, so it creates a little more depression or a fossa, and this is called as canine fossa, which is not present in the mandibular premolar. Palatal cusp is well developed. So we can see that this is a buccal cusp and this is a palatal cusp. So there is a height difference between buccal and palatal cusp, but palatal cusp is well developed in maxillary premolar, whereas in mandibular premolar it is rudimentary. Now the crown is hexagonal in shape. So if we see the crown shape, it is roughly hexagonal, whereas in mandibular premolar it is more like a oval or circular in shape. So these are arch traits. Now let us see the type trait. So type trait is differentiating points between the maxillary first and maxillary second premolar. So we need to differentiate between maxillary first and maxillary second. So I will keep both the teeth in anatomical position and we will differentiate. Now type trait. So first is central groove is longer in maxillary first premolar. So if we see the cast also, we can easily differentiate. This is a crown of maxillary first premolar and second premolar. We can easily differentiate the length of central groove. It is more, and we can see it is very small here, okay, on both the sides. So the lengthwise, the maxillary first premolar has longer central groove, and mandibular and the second maxillary molar has little smaller central groove. Then root is bifurcated. So maxillary first premolar has bifurcated roots and second has usually single root. Then crown is hexagonal, not oval in shape. So this is very important. We can see here it is roughly hexagonal in shape and it is more oval in shape. Second premolar has more oval in shape. We can clearly make out it is more oval in shape. Next is as I have already shown you, mesial marginal groove and canine fossa is present in first premolar, which is absent in second. then height difference is more between the cusps. So if we see the height difference between the cusp in first premolar is more, but if you see here the height difference is not much, so more or less they are equal. Now the class traits is why this tooth is a premolar and not the incisor, canine and molar. So premolar they have two cusps, whereas incisors have incisal edge, canines have single cusp, that is why they are called as cuspids, and molars have multiple cusps. There is one more feature to mention, like whether it is of right side and left side. For every tooth we need to mention the side. Now side identification is very, very important. Every tooth has some important feature on the mesial or distal side, which are collectively called as proximal sides. Now maxillary first premolar on mesial side has this groove. This is called as mesial marginal groove. It starts from mesial pit, crosses the marginal ridge and terminates on the proximal surface, and you can see a slight depression also, which is called as canine fossa. So during exam quickly you need to identify. So imagine you have a cast in front of you and then try to place it according to the side. Suppose if I keep it on this side, the mesial marginal groove is facing towards the third molar, so it is not of this side. And then suppose if I keep it on this side, the mesial marginal groove, since this is the terminology is mesial, so it is a mesial marginal groove, it should face towards the midline. Okay, so this is of right side. So this is a patient's cast, and imagine patient's mouth, and this is of right side. So this is of right side and it is correctly placed. So this is mesial marginal groove, you can make out this one, and it is facing towards the midline, towards the mesial. So this becomes right side. So this much information is enough to write in the exam. Thank you.